Hi students, today topic is Graves' disease. Graves' disease is a autoimmune disorder. It is a autoimmune disorder. So autoimmune disorders here is the antibodies produced against the self antigens. The self antigens are TSH receptors. TSH receptor is the self antigen. So the name of the antibodies here is a TSI. Thyroid stimulating immunoglobulin. So what did they do? The TSI antibodies binds to the TSH receptors and mimics its action, binds to the TSH receptors and increase the adenyl cyclase activity, thereby increasing the synthesis of T3 and T4. TSI binds to TSH receptor and thereby increases the adenyl cyclase thereby increases the adenyl cyclase thereby increases the releasing of T3 and T4. Again I repeating, Graves' disease is an autoimmune disorder characterized by the production of autoantibodies against multiple thyroid protein. The thyroid protein is TSH receptors. The most common antibodies are thyroid stimulating immunoglobulins are the antibodies, autoantibodies. What they do? TSH binds to the TSH receptors and stimulate the adenyl cyclase and increases the release of thyroid hormone, thereby causing hyperthyroidism. Hyperthyroidism is the feature of the Graves' disease. To the morphology, in morphology, diffuse hyperplasia and hypertrophy of thyroid follicle. So diffuse means totally it's all. It will undergo hyperplasia and hypertrophy. How it look like? The beef meaty appearance. It look like beef meat appearance. Beef meaty appearance is the beef meaty appearance and hyperplasia and hypertrophy of follicles. Diffuse hyperplasia and hypertrophy of thyroid follicles. What happens here is the follicles will undergo hyperplasia and hypertrophy, thereby histology. The colloid has scaffold margin. Scaffold margin. So it is a colloid cells. Colloid cells is lined by cuboidal epithelium. In between you see the infiltration of plasma cells and lymphocytes. So compared to the B lymphocytes, T lymphocytes there the more. You also see the hyperplasia of lining epithelial cells. And you center you see the colloid is has a scaffold margin. The scaffold margin is characteristic feature of thyroid Graves' disease. Another characteristic clinical findings is the appearance of sound is brute. Brute sound is a characteristic features of Graves' disease. How it produces the diffused hyperplasia and hypertrophy of thyroid glands require more and more oxygen. So there is an increasing blood flow to the follicles. Thereby, they produce a sound. The hyperplasia and hypertrophy of plasia and hypertrophy of follicles requires more oxygen. Activated T cells releases cytokines. They increase the proliferation and increase the synthesis of extracellular matrix like glycosaminoglycans, like heparan sulfate, chondroitin sulfates. These are accumulated in the retroorbital space, thereby protrude the eyeball. So, by like this exophthalmos occurs. The clinical features are ophthalmopathy, dermopathy, and hyperthyroidism. So, ophthalmopathy, exophthalmos, protrusion of eyeball. So, how it is happened, I will tell. Overactivity produces staring gaze, lid lag. So, the thyroid hormone which sensitizes beta adrenergic receptors to this sympathetic activity, thereby sympathetic activity also increases in the Graves' disease. T3 T4 level are increased because of hyperthyroidism, and TSH will decrease due to loss of feedback and increase uptake of iodine. Treatment: to reduce the sympathetic symptoms we give beta blocker, and to reduce the thyroid activity we give thioamides like propylthiouracil and radioactive ablation. Thyroidectomy is the ultimate treatment.